The smell of a hospital at 3 a.m. is its own specific kind of misery. Burnt coffee going stale in the pot. Nobody emptied. The chemical sweetness of the floor cleaner mixed with something underneath it that never quite goes away no matter how many times the janitors mop. Somewhere down the hall, a monitor is alarming for a loose lead, and nobody is moving fast enough to silence it. This is not the controlled, brutal quiet of a forward operating base. This is something worse. This is chaos with paperwork. Sable Thorne had learned to breathe through it. She kept her movements small, economical. She'd been at Clement Regional for 7 months, and she had already figured out that the fastest way to survive the night shift was to make herself invisible. Chart quietly. Answer when spoken to. Don't volunteer anything. The nurses who volunteered things in this ear either got crushed under extra assignments or got laughed at in the break room. Sable had made the mistake of volunteering information exactly once. On her 3rd week, when she'd flagged an early sepsis presentation on a patient Dr. Lennox had already signed off on. She'd been right. The patient went to the ICU 6 hours later. Lennox had never forgiven her for it. She was pressing a fresh piece of gauze to a laceration above a teenage boy's eyebrow when nurse supervisor Claudette Brune materialized in the doorway of Bay 4. Claudette had a way of appearing rather than arriving, like she'd been waiting just out of frame the entire time. She was holding her tablet against her chest, and her expression was the particular brand of tight-lipped disapproval she reserved for Sable specifically. "You're running 12 minutes behind on your discharge paperwork," Claudette said. "Patient in Bay 4 isn't discharged yet," Sable said. She didn't look up. She was watching the laceration, gauging the depth. It needed 3 sutures, maybe 4 if the kid kept making faces. Bay 4 should have been closed out 40 minutes ago. Bay 4 needed a proper assessment. The lacerations deeper than the intake noted. Claudette made a sound that wasn't quite a sigh and wasn't quite a scoff. It landed somewhere in between and carried the specific weight of institutional condescension. "Thorne," she said the name, the way people said the names of things that annoyed them. "I don't know how things ran at your last facility, but here we operate on throughput. If you can't keep pace with the floor, 3 sutures, Sable said quietly. Then he's done. A beat of silence. "I'm noting this in your performance log." Claudette left. The teenager looked up at Sable with wide eyes. "Is she always like that?" "Hold still," Sable said. She sutured him with the same precision she'd used to close a chest wound on a corpsman in a sandstorm outside of Marja, with one functioning light source and her own body shielding the field from the wind. Her hands didn't shake. They'd stopped shaking a long time ago. She tied off the last knot, snipped the thread, covered the site with a sterile strip, and handed him his discharge instructions without ceremony. The night shift had a social architecture that Sable had mapped in her first 2 weeks and then deliberately avoided engaging with. Dr. Lennox anchored one end of the charge desk, second year attending, good hands, catastrophically insecure about his authority. A rotating constellation of float nurses orbited him, laughing at the right moments, handing him things before he asked. The charge desk was the sun. Everyone else was either in orbit or irrelevant. Sable was irrelevant. She'd chosen it. She settled at a terminal on the far end of the station to chart. Lennox glanced over. He had the look he got sometimes. Not quite hostile, more like puzzled irritation, like she was a piece of furniture arranged wrong that he kept noticing and kept not moving. "Thorne," he said, loud enough to carry. A float nurse named Pell looked up from her phone. You know we had a code in Bay 2 last week while you were on break? I was on break, Sable said to the screen. Right. He smiled at Pell. Just making sure we're all reading from the same page on availability. Pell giggled. She was 23, and she thought Lennox was brilliant because he'd once described a procedure with a metaphor involving football. Sable typed her notes and said nothing. She felt the slow, familiar pressure building at the base of her skull. Not anger exactly, more like the physical sensation of holding something very heavy for a very long time. She had not told anyone what she was. It wasn't deception. Her application had listed her prior employment as a military healthcare contractor. It was accurate. Nobody had asked follow-up questions. People saw a 32-year-old woman with a quiet manner and steady hands, and they made their assessments, and those assessments were wrong, and Sable found it was generally easier to let them be wrong. The truth would not make her life simpler. The truth was that she had spent 8 years as a special operations combat medic attached to a joint special operations task force, and that she had more field trauma hours than anyone in this building, including the director of emergency medicine, who had a framed certificate on his wall from Johns Hopkins, and had never once held pressure on a femoral bleed in the dark, with the sound of rotors overhead, and a man dying underneath her hands. She'd saved 17 lives in the field. She'd lost 4. The 4 lived in her chest in a way the 17 didn't. That was another thing nobody here knew about her, and another thing she had no intention of sharing. She went back to her charts. The call came at 11:47 p.m., not a radio call, not a scanner alert. It was a physical sensation first. A low, structural vibration that moved through the floor tiles and up through the soles of her shoes before it registered as sound. An industrial rumble, too heavy and too close. Sable stopped typing. The emergency line at the charge desk rang. Claudette answered it, and Sable watched her face change, the professional scowl flickering, replaced by something rawer. Claudette's hand found the edge of the desk. "How many?" she said. Her voice was different, stripped down. Sable was already pushing back from the terminal. A train derailment. A freight carrier had jumped the tracks on the elevated line 2 miles from the hospital. The lead cars had come down on a surface road. 4 confirmed fatalities at the scene. 8 to 12 incoming casualties, variable severity, crush injuries, lacerations, possible blast involvement from a ruptured fuel tank. The ER fractured into motion. Lennox went loud immediately, the way he always did when the situation outpaced his preparation. He started calling out assignments before he'd finished processing the information, his voice climbing in pitch. Pell and 2 other floats began pulling supply carts, crashing them into each other in the hallway. An orderly dropped a full bedpan. The overhead lights felt suddenly harsher. Sable moved toward the supply room at the far end of the bay corridor. Quietly, she took stock of what was on the shelves: tourniquet inventory, chest seal supplies, airway kits. She did the math in her head. 8 to 12 casualties, variable severity, trauma bays 1 through 3, overflow protocol. She calculated. She began pulling. The first rig came in at 11:53. The smell preceded it by 5 seconds, rolling through the open ambulance bay doors ahead of the gurney. Scorched metal and something organic underneath it, heavy and hot. Sable's body recognized it before her mind did. Every muscle between her shoulder blades tightened, then released, and what was left in their place was something cold and very, very still. 2 paramedics pushing hard. Male, approximate age 50, unconscious, crush injury to the lower extremities, pelvis compromised, pressure dropping, Lennox took him to Bay 1, the second rig. Female, 30s. Lacerations to the face and arms, alert and screaming, which meant her airway was clear and her brain was perfusing. Not the most critical patient in the load. The triage algorithm ran through Sable's head automatically. The third rig. This was the one. A boy, maybe 19, maybe 20, and his color was the wrong color. Not pale. Pale was shock. Pale was fixable. This was gray, the particular ashen gray of a body beginning the process of withdrawing from the surface. His left arm was trapped. Not anymore. The paramedics had freed him, but the crush injury had been proximal and long, and the damage was catastrophic. The tourniquet the paramedics had applied was a standard issue BLS band, positioned wrong, not high enough, and the boy's blood pressure was 62/40 and dropping. Bay 2, Sable said. Her voice didn't carry the way Lennox's did. It didn't need to. It was a different kind of volume, frequency rather than amplitude. The paramedics turned toward her without hesitation. Practiced obedience, recognizing practiced authority. They went to Bay 2. Sable followed. Pell was in the doorway, looking at the gray-faced boy on the gurney, her hand at her mouth. She was not going to be useful in the next 30 seconds. "Get out of the doorway," Sable said. Not unkindly, just factually. Pell moved. Sable snapped on gloves and went straight to the tourniquet. She released it, repositioned it 4 inches higher on the arm. Junctional, the way it needed to be, and re-tightened it to occlusion. The blood that had been seeping through the gauze at the distal application site slowed. "What's his pressure?" she asked the paramedic. "Last read 62/40. When?" 4 minutes ago. "He's lost somewhere between 2 and 3 liters. She reached for the IV access site they'd established. 18 gauge, right antecubital. She didn't say anything about the placement. She just pulled another line kit and established a second large bore access in the external jugular with the efficiency of someone who had done this 100 times because she had done it 100 times. In worse light, in worse conditions, in vehicles that were moving and occasionally on fire. Lennox appeared in the bay doorway. "What are you doing?" His voice was sharp, with the kind of alarm that wasn't entirely about the patient. His tourniquet was too distal. "I repositioned it. He needs massive transfusion protocol. 2 units of packed red cells minimum, FFP. We need to get his pressure back above 80 before we can even think about surgical consult. I didn't authorize. He's going to arrest in the next 3 minutes if we don't get volume in him." Sable looked up from the IV line. She looked at Lennox directly. She'd been avoiding his eyes for 7 months. She wasn't avoiding them now. "You can document this however you want afterward. Right now, I need you to either help or move." Something happened to Lennox's face. The authority reflex misfired. It tried to reassemble itself and couldn't quite get all the pieces in the right order. He stared at her hands, which were moving with a speed and precision that didn't belong to someone who'd spent 7 months charting discharge paperwork. On the far end of the station, he stared at the external jugular line, perfectly placed, already running. "Massive transfusion protocol," he said finally, to the tech behind him. Not to Sable, but he said it. "Good," Sable said. She turned back to the patient. She worked the boy's pressure back to 91/60 in 11 minutes. Lennox assisted, mostly by doing what she indicated when she indicated it, which was the most useful thing he'd done in Bay 2 all night. The surgical team came down to collect the patient at 20 past midnight. He was conscious and confused and asking about his dog. Sable thought he was probably going to be fine. She went to the staff bathroom and scrubbed her hands and forearms with surgical soap. The water ran pink for a while. She looked at her hands in the mirror. The small, lateral scars across the back of the right hand, from a piece of vehicle debris in Kunar province. The heavier coalescing along the outer edge of her left palm. She had been trying very hard for 7 months to have the hands of a regular civilian ER nurse. She was not sure she'd entirely succeeded. Claudette found her coming out of the bathroom. Lennox filed a concern, Claudette said. Her voice was different from usual. Quieter, harder to read. Says you repositioned a tourniquet without authorization. Established vascular access outside the scope of the attending's management plan. The patient is alive. That's not the... I know that's not the point. I know how this works. Sable looked at Claudette steadily. Write it up. I'll respond through the proper channels. Claudette looked at her for a moment, really looked at her, the way she hadn't in 7 months of managing her like a performance metric. Where did you work before here, Thorne? Really? It's in my file, Sable said. She walked back toward the floor. The review board meeting was scheduled for the following Thursday. In the interim, she was placed on modified duty. No trauma bay assignments, administrative tasks only, pending the outcome of the formal inquiry. Lennox avoided her with the careful precision of a man who had said something he couldn't take back and wasn't sure yet how much damage it had done. Claudette was professionally neutral in a way that felt somehow more pointed than her usual hostility. The other nurses orbited carefully around the situation, calibrating their social risk. Sable charted. She answered phones. She scheduled follow-up appointments. She was very good at all of it and found none of it occupied more than 20% of her attention. The Thursday board meeting fell on a day. Sable worked the morning shift. She was sitting in the hallway outside the conference room at 8 a.m. with a paper cup of cold coffee and the particular stillness of someone who has waited in worse places for worse outcomes when the sliding doors at the end of the main corridor opened and she heard it. She heard it before she processed it. The cadence of boots on a hard floor. Not civilian shoes, not soft-soled athletic shoes, hard-soled, laced-high military-grade footwear. Moving in a formation that wasn't quite a formation because these men had been trained past formations. Moving with the individual collective rhythm of a unit that had trained together until coordination was automatic. 4 of them. Moving fast but controlled. The smell, aviation fuel, salt water. The specific copper and iron chemical signature of blood that had oxidized. Sable was on her feet before she finished identifying the smell. She turned the corner and saw them. 4 men in civilian clothing that was patently not civilian. Tactical pants, plate carrier outlines visible under loosely worn jackets. The quiet bulk of men who lived under weight. 3 of them were surrounding the 4th, who was being half carried between the 2 on the outside. He was conscious, but the wrong kind of conscious. Eyes too wide, breathing too fast, hand pressed against his right side where someone had applied a pressure dressing that was saturated through. The man doing the carrying on the left had a face Sable recognized in the way you recognize certain geography. Not from a memory you could name immediately, from the part of your brain that catalogs danger and safety, and the specific faces of people who have stood between you and both. He saw her at the same moment. He stopped. Vasquez, he said. His voice was very controlled for a man who was holding up an injured colleague and had clearly not slept. Vasquez, is that? Are you? She was already moving toward them. What happened? She said, not a question. The man on the left, Drummond, Her brain supplied. Lieutenant Commander Drummond. She'd worked a joint extraction with his team out of Kunduz, 2019, shifted the injured man's weight. Training dive, offshore platform, equipment failure on the way up. He got hit by a swinging crane arm during the surface abort. We couldn't make it to Walter Reed. This was the closest facility with a trauma bay. The injured man's name came up in the next breath. Torres, Petty Officer First Class Torres. She didn't know him. His face was gray and tight, the expression of someone managing severe pain with the last reserves of professionalism. Right side, she said to Torres. Talk to May. Ribs, Torres said through his teeth. 3, maybe 4. Something popped on the left too. Breathing's getting. There's something. He stopped. Pressed his lips together. Something's wrong with the left. Tension pneumothorax was the first thing that went through her head. Left lung compromising, air accumulating in the pleural space, no way out. The pressure building until it pushed the mediastinum across and took the heart with it. She'd seen it twice in the field. It killed fast, and it killed quietly, and it killed people who had survived everything else. How long on the transport? 40 minutes, Drummond said. How was his breathing 40 minutes ago? Better. She looked at Torres's chest. She watched the rise and fall. The right side was moving. The left was lagging. Can you take a deep breath? She asked him. Torres tried. The left side didn't expand. His jaw clenched hard against whatever that cost him. That was all she needed. She turned toward the nurse's station. Claudette was standing there. So was Lennox, who had come in early for the board meeting. They were both watching with the particular frozen quality of people who have encountered something outside their reference frame. Tension pneumothorax developing left side, Sable said. Her voice was the voice from before the 7 months, the voice from the other side of the box she'd been keeping things in. I need a 14-gauge needle, longest we have. I need him in Trauma Bay 1. Now. Lennox blinked. You're on modified duty. You can't. Drummond turned his head toward Lennox. He didn't say anything. He just looked at him. It was a brief, complete, and apparently sufficient communication, because Lennox stopped talking. Doctor. Lennox, Sable said, not looking away from Torres. I need the needle, and I need the bay. You can assist or you can document. Pick one. A long second. Bay 1, Lennox said. They moved. In the bay, she talked while she worked. She talked to Torres. Stay with me. Keep your eyes on me. Tell me where you grew up. And she talked to Lennox. I need the tray with the thoracic kit. Second drawer. Yes. The whole tray. And she talked to the tech, who materialized in the doorway, a young woman named Brecht, who had the sense to enter the room and position herself at the supply cart without being asked, which Sable filed away as someone worth working with. Torres was from Billings, Montana. He'd enlisted at 19. He had a dog named Pepper and a sister who was a school teacher, and he told her both of these things in short, effortful bursts, while Sable found the second intercostal space, mid-clavicular line, left side, and drove the 14-gauge needle in. The hiss was immediate. The rush of trapped air escaping into the atmosphere was one of the more reliable sounds in emergency medicine. Not dramatic, not loud, just a sustained exhalation of pressure that had been building toward catastrophe. Torres's next breath was visibly easier. His shoulders dropped a half-inch from where they'd been braced. There you go, Sable said. She converted to a proper chest tube with Lennox assisting adequately. More than adequately. He had good hands when he wasn't performing for an audience, and she had always suspected this, but never had cause to confirm it. By the time the chest tube was draining, and Torres's oxygen saturation had climbed from 87 to 94, the room had accumulated several additional observers. Claudette, David Farris, the director of nursing, who had arrived for the board meeting and gotten considerably more than he'd planned on. 2 of the night shift nurses. Still finishing their charting, Drummond and the other 2 operators, who had positioned themselves just outside the bay doors, with the specific stillness of people trained to wait without agitation. When Torres was stable enough for imaging, and the surgical fellow had been paged, and the immediate crisis was managed, Sable stepped back. She stripped her gloves. She dropped them in the biohazard bin. She became aware of the silence in the room in a way she hadn't had the bandwidth to be aware of during the preceding 18 minutes. She turned around. Drummond was in the doorway. He'd removed his jacket. The subdued unit patch on his left shoulder was visible. A designation she was not going to describe aloud in a civilian hospital, because it was the kind of designation that made civilians ask questions that were complicated to answer. He looked at her for a moment. The look contained a lot of things. Recognition. Something that wasn't quite relief but was adjacent to it. The recalibration of seeing someone from a specific context appear in a wildly different one. "You want to explain to me," Drummond said, "what you're doing in Ohio." "Trying to live a quiet life," Sable said. He made a sound that was almost a laugh. "How's that going?" She didn't answer that. She turned to Farris, who was standing near the doorway with the expression of a man who had come in to conduct a disciplinary review and was now standing in a room that had rearranged itself around a different set of priorities. "My suspension," Sable said. Farris looked from her to Drummond to Torres, now breathing steadily on the bay bed with a chest tube in place and color returning to his face. The board meeting. Still happening? Farris cleared his throat. He adjusted his glasses. He looked at Drummond again, which was probably not a strategically useful thing to do, because Drummond's expression was the expression of a man who had survived several things that made hospital administrative reviews look extremely small. "I think," Farris said carefully, "we may need to revisit the parameters of the review." "That's fine," Sable said. "I just need to know if I still have a job at the end of this shift." Drummond stepped into the bay. He looked at Farris with the calm, direct attention of someone who is accustomed to being the most dangerous thing in any given room and has made peace with it. "This woman," he said, "has more hours under combat medical conditions than most trauma surgeons accumulate in a career. I would like to understand what exactly the concern is." Claudette opened her mouth. "Rhetorical," Drummond said. Claudette closed her mouth. Farris looked at the floor, then at the ceiling, then at Sable. "The review is canceled," he said. "Your badge remains active." He left the room with the efficiently retreating energy of a man grateful to have somewhere else to be. Sable nodded. She looked at Brecht, the tech, who'd had the sense to position herself at the supply cart. "Help me get this bay prepped for the next patient," she said. Brecht said, "Yes, ma'am." Lennox was standing by the IV pole. He was looking at Sable with the particular expression of someone who has been building a narrative about another person's for a long time and has just had significant structural elements of that narrative removed. He looked uncertain. He looked, in this specific moment, young. "Thorne," he said. She glanced at him. "The tourniquet repositioning, last week." He paused. He was choosing the words carefully, which was not something she had observed him do often. "You were right. I know," she said. She wasn't cruel about it. She just said it and moved past him toward the supply cart, because there was work to do and the supply cart needed restocking, and Brecht had the right idea about where to focus energy. In the hallway, Drummond fell into step beside her. He matched her pace easily. He was 10 inches taller and built like something that moved freight, and he still matched her pace, which was a small habitual courtesy she remembered about him. "We need someone," he said, "on the medical side. Consulting position, short-term joint contracts, flexible hours. I have a job. 2 jobs isn't impossible." She didn't say anything for a moment. They walked past the nurse's station. Claudette was standing there. She watched Sable pass and said nothing, which was its own kind of communication and not the hostile kind. Something else. Something quieter and more considered. "I'll think about it," Sable said. Drummond nodded. He understood the way people who have worked in environments where resources are finite and decisions are irreversible understand. That thinking about it was not a dismissal. It was the correct response to a real question. He stopped at the elevator that went to the helipad. "It's good to see you, Vasquez." "It's Thorne now," she said. He looked at her. A brief, acknowledging look, the look of a man who understood why someone might make that kind of adjustment and wasn't going to press on it. "Thorne," he said. He got in the elevator. The doors closed. Sable stood in the hallway for 3 seconds. The fluorescent lights hummed their relentless flat note above her. The monitor down the hall was alarming again. Mrs. Something, third bed, had probably pulled her pulse oximeter off again. The smell of the floor cleaner had reasserted itself over the aviation fuel and the copper. She walked toward the alarming monitor. She didn't feel triumphant. She didn't feel vindicated. She felt the specific weight of having been fully herself in a place she had worked very hard to be invisible in. And she wasn't sure yet what to do with the fact that the weight of being visible was not entirely lighter than the weight of being hidden. Just different. Just a different shape of the same thing she carried everywhere. She reattached the pulse oximeter. The alarm silenced. She went back to work.